Chapter 4, DENTCA-4 Introduction. DENTCA-4 is a full mouth implant zirconium or PMMA CAD/CAM milled restoration with either segmented titanium bars or multi-unit abutment technology. DENTCA-4 comes in two different restorative formats. The TBar, which is our segmented bar technology that gives you a lot of freedom when placing your implants, or the MUA, which is more suited for our veteran all-on-4 dentists. Superstructures can either be made of zirconium with layered porcelain for the gums or PMMA with layered composite. All gum and teeth shades that you can find in your Vita Shade Guide are available for order. A few benefits of DENTCA-4 mill superstructures are that there's accurate design and predictable results with our DENTCA software, just like with our dentures. Also easy duplicates due to the presence of backup files and simple maintenance appointments. One of the biggest challenges that you encounter with conventional all-on-4s is difficulty to replicate them if they break or if there's an issue with them, as well as the maintenance appointments and taking them on and off from the mouth. With the DENTCA system, it takes you roughly 5 minutes to remove the superstructure, clean out, and then reapply the cement. Roughly overall, I would say 15 minutes to 20 minutes would be your average maintenance appointments for a DENTCA-4. Additionally, minimal space is required for a DENTCA-4 case, which is 6.5mm per arch or 13mm overall. Normally, with conventional all-on-4s, you would need 13mm per arch or 26mm for the entirety of the case if you're doing an upper and lower. This could save your patient from needing bone reduction surgery. The only reason I would do bone reduction surgery in a DENTCA-4 patient is if you have a high smile line and you want to reduce it for aesthetic reasons. And last but not least, since the T-bars can be extended posteriorly, we can give the superstructure full cantilever support without the need of having one complete bar. As far as mill superstructure options in terms of finishing, we have a ridge lap design where we can extend the labial side to make it more aesthetic. We have what we call a modified design where we leave the superstructure at the height of the bars or the implant connection. This is to make it both aesthetic and easily cleanable, or we have a hygienic version where we can expose a little bit more of the space between the gums and the superstructure for even easier cleaning. So what requirements are necessary to do a DENTCA-4 case? You need to have at least one fully edentulous arch. 4 to 6 implants must be present in the arch with at least 2 implants per side of the arch. They must be bone level and internal hex. All major blands are supported, and all implants must be fully integrated prior to taking impressions for a DENTCA-4 case. A minimum distance of 7mm must exist between each implant, I'm talking center to center, and 13mm of interarch space clearance for a complete case or 6.5mm for a single arch is required. The way the general flow for DENTCA-4 goes is as follows. Records will be taken to be able to obtain the implant position and the vertical dimension and bite of the patient. Then a DENTCA-4 will be designed. If you're doing a T-bar, design bars will be milled. They will be placed in the mouth, and then a wash will be taken as well as a bite, and then a provisional will be delivered. After that, changes will be submitted to DENTCA, and DENTCA will manufacture your final denture, which you will be placed on your patient's mouth on your third appointment. DENTCA T-bar. As we mentioned before, there are two restorative options for DENTCA-4. Right now we're going to talk about option A, which is the T-bar option. The T-bars are a very special technology created by DENTCA. They are unique in the way that they actually correct the angulation of your implants to ensure a vertical insertion for your cases. This means that you can place the implants where they're most convenient, where there's more bone, to be able to save your patients the need of bone grafting surgery or a sinus lift surgery. Also, if you're not an expert on AP spreads and implant parallelism, this is a great system for you to start getting involved with all-on-4s without the hassle of needing to know a lot of details about the implant placement. Bars, of course, do not require the use of multi-unit abutment. Essentially, your bar is your multi-unit abutment, and custom design will match your implant position and angulation. These are titanium bars, and you would have 1 bar per implant. So if you have 4 implants, you would get 4 bars in 1 arch. This is ideal for dentists who are beginners in restoring all in 4 cases, veterans who want to simplify the way they make these procedures, or when tackling different gold implant cases that require odd angulations or have areas with big bone defects, for example, patients that have cancer. For example, take a look at this image right here. This was a case where the doctor received the patient, implants were already in place, and the case could not be restored in any other way except using DENTCA. Because of the angulation and the position of the anterior implants, multi-unit abutments could not be used. This was over 40 degrees. So the only way that it could be restored was by creating a custom abutment. In this case it was a TBar, so the doctor could restore the case. There are of course consequences to angling your implants anteriorly so much, which means we will have to place the bars further labially, and they could create a little bit of an airflow when the patient speaks, as well as maybe be a little visible. However, the case can definitely be restored with this technology. What are some of the DENTCA-4 TBar considerations? Superstructures can be fixed to bars with 2 or 4 screws. They must be ordered through DENTCA.com. At this moment you cannot design them on DENTCAdesign.com. And the first provisional will be milled to be delivered to your patient. If you were to need additional tries, they can definitely be requested. However, these will be 3D printed only for you to verify fit and adjustment, but not for them to be delivered on a second appointment. As far as record taking goes, we will need 2 things. We'll need an implant level impression or implant level records, and we need vertical dimension and CR records. Let's talk about a fully digital option. So if you have digital capabilities in your office, that is an intraoral scanner and a CBCT scanner, you can go impression free. So the way it works is this. For implant level impressions, you will require scan bodies in an intraoral scanner. You will place your scan bodies in the patient's mouth, and then you will scan the arches. If using scan bodies, it's necessary to acquire them at DENTCA.com to ensure the compatibility. Ordering scan bodies on our website is easy. Simply visit DENTCA.com, log into your account, then click on Orders and DENTCA-4 Auxiliary, and take a look at all the scan body options that we offer. Then click on Order and check out. As far as vertical dimension and CR records, the easiest way would be to just take a CBCT scan of your patient wearing their conventional dentures and have them bite at their CR position. Please make sure that you do not use a bite stick when taking your CBCT scan. As mentioned before, if you use this technique, you can go impression free. There is no need for you to take any impressions. So what to do if you don't have a CBCT scanner or an intraoral scanner? The easiest way to do this would be to take an open or closed tray for implant level impressions, and then take the vertical dimension and CR records utilizing the DENTCA trace as described in Chapter 2. If you're doing a single arch opposing a denture that will not be replaced, a CBCT technique cannot be used. This is because you would not be able to see the denture in the CBCT scanner. Instead, you must use the VDCR record taking method with the DENTCA trace. Very important, if you're going to be doing a closed tray method, please do not place the laboratory analogs, as we will be scanning the impression and we need to be able to see the hex portion of the copings. If you do place these laboratory analogs, Zdenka would need to remove the copings to separate the laboratory analogs and place them back in, and a change in the hex position could happen. This would result in a rotated TBar during your try-in delivery. As a short summary, there are 3 routes for record taking: fully digital with CBCT scanner, intraoral scanner; semi-digital, where you can combine a CBCT scanner with an open tray or an intraoral scanner with the DENTCA trace; or fully analog, which would be the open or closed tray impression and the DENTCA trace. Once finished with your records, it will be necessary to package any physical impressions that you might have taken and place an order on the DENTCA website. To place an order for DENTCA-4, visit DENTCA.com and log in, then click on Orders, CAD/CAM Denture, and find the DENTCA-4 product that you wish to order, whether it's single, large, or complete. Then click Order and finalize checkup. Once DENTCA has received your case, they will align it, design the bars, and set the teeth, and create a superstructure provisional and a wash tray for your second appointment, as we can see in the following video. Now let's take a look at what happens during the second appointment. When you receive your case, you will receive an adjustment evaluation form and instructions to guide you through the delivery process for DENTCA-4. In the box, you will also encounter your T-bars and the delivery screws, as well as a wash tray which won't have any screw holes, and a milled provisional. The first thing that's recommended to do is to place the bars inside the provisional outside the mouth. This will give you a sort of lay of the land to know which bar belongs to which implant, to ensure that they're going to be placed in the correct location. The first step in your try-in delivery would be to remove the healing abutments and place the bars, tightening them to 30 Newton centimeters. Once all the bars are in place, take the wash tray, fill it up with heavy body PVS and seat it over the bars. Ask the patient to bite down, and once polymerized, take a new bite on CR position. Take the DENTCA-4 provisional, seat it in the mouth to make sure it fits properly. Check the bite. Apply temporary cement in the non-screw sockets and then seat it in the mouth. Afterwards, attach the DENTCA screws in place and tighten them to 10 Newton centimeters. Once you deliver your provisional, it's imperative that you instruct your patient on how to clean utilizing a water flossing device, for example, a water pick. Then proceed to send the wash and the bite back to DENTCA and request them to make the final denture. Depending on your choices, you can request a milled PMMA restoration or a milled zirconium restoration. This time between appointments is a great time to evaluate whether the patient is cleaning properly or not. You're going to see the patient roughly in about 2.5 weeks to deliver the final. So do take this opportunity to see how well your patient cleaned during those weeks and make sure you reinforce any bad cleaning habits to avoid the implants from failing. For the final delivery, simply remove the provisional from the mouth. Make sure the entire area is clean and free of food residue. Then sit and try the final superstructure in the patient's mouth. Apply fresh cement into the non-screw sockets and then seat it in the patient's mouth, securing it with the DENTCA screws. Tighten them to 35 Newton centimeters for zirconia and 10 for PMMA. Once your final is delivered, again, water pick is a must. Give the provisional back to the patient since it's a great backup in case of emergencies. So if something happens to that final superstructure, the patient can quickly come back to your office. You can deliver the temporary provisional again and request a new final from DENTCA. Maintenance appointments should be made first one after a month of delivery, then every 3 months for the first year, and after that, depending on how well the patient is cleaning, you can switch him to every 4 to 6 months. To order additional DENTCA screws on the website, simply visit DENTCA.com, go to Orders, DENTCA-4 Auxiliary, and scroll all the way to the bottom to find the DENTCA screws. Then click on Order and finalize the checkout process. Now let's take a look at our multi-unit abutment option, or as we like to call it, and DENTCA MUA. DENTCA MUA utilizes a particular abutment cap solution that makes it possible for you to connect the superstructure to the multi-unit abutments. Please note that DENTCA will not provide you with multi-unit abutments. These must be placed and purchased by you. It must be ordered through DENTCA.com as well, and the first provisional will be milled. And just like with DENTCA-4 TBar, if you require any additional tries, these will be 3D printed simply for you to verify fit and adjustment, but they won't be made ready for delivery. DENTCA's MUA system is very similar to the TBar technology. However, it will utilize multi-unit abutments instead of TBars. The way it works is you will cement these MUA cylinders into the superstructure and then screw it in directly into your multi-unit abutments. In this instance, you will have one superstructure screw per abutment instead of the 2 or 4 options for the TBar. This system is ideal for dentists who are more familiar with implant placement and multi-unit abutments, and patients where bone density and quantity allow for implant parallelism and AP spreads. It's also recommended that if you're doing an MUA restoration, you utilize a guided surgery procedure, since you will need to make sure that all your implants and multi-unit abutments are parallel. As far as record takings go, it will be the same procedures as you did with DENTCA TBar, with the one exception that if you're utilizing scan bodies, you will need to have a special set of scan bodies that can seat over the multi-unit abutments. The rest of the protocols would be exactly the same. To place an order for DENTCA-4 MUA is the same way as the way you would order a conventional DENTCA-4 TBar. Go to orders, then CAD/CAM denture, find the DENTCA-4 product and click on order. Except this time, under special instructions, please type that you're ordering an MUA DENTCA-4 and type down the multi-unit abutments that you will be using for this order. Just like with the TBar, once you receive your trying and your provisional, you will receive a trying evaluation and adjustment instructions. You will also receive your multi-unit abutment copings and a 3D printed multi-unit abutment coping holders. You will also receive your implant screws, a 3D printed wash tray, which will have no screw holes, and a mill provisional with the screw hole. Once you have delivered your provisional, send everything back to DENTCA and they will redesign if any changes are necessary and either send you a PMMA final or zirconia final depending on what you requested. Again, as final considerations go, water pick is a must. give the provisional back to the patient, as it's a great backup in case of emergencies. And again, maintenance appointments should happen first one after a month, then every 3 months for the first year, and then switch them to every 4 to 6 months after. Now I would like to talk about something else. DENTCA understands that you want to keep everything on the same umbrella, so we have created different implant placement solutions as well as temporary solutions that will allow you to deliver a provisional in the same appointment that you place your implants. For implant placement solution, we offer two options. The first one is a guided surgical guide, and then a surgical stent. The surgical stent basically gives you freedom to place your implants in the space that you can see on the palatal section of this particular surgical stent. Surgical stents can come in clear color or in teeth color. As far as temporary placement solutions, DENTCA can offer you three different types. We have one where it can sit over the healing abutments, another one that can sit directly connected to the implants via temporary abutment cylinders or immediate dentures. Now let's take a look at the flow for our implant placement solutions. So first thing is you would order either a guided surgical guide or a surgical stent, and then you would use it to place your implants. Once your implants are in place, you would be choosing one of the three options for either immediate or delayed loading, and once your implants integrate, then you can either do a TBar or a multi-unit abutment provisional, eventually leading to your DENTCA-4 final placement. As far as clinical protocols for the surgical guide go, you have a few options. The first option you can do is, if you have an existing denture, you can place radiographic markers on the existing denture that scan the entirety of the denture. After that, take a CBCT scan of the patient biting and centrangulation, making sure that these radiographic markers are in place when you do the CBCT scan. Another option you can use for dentate patients is to directly scan the arches in the mouth and then take a CBCT scan of the patient. If you have an edentulous patient and you do not have radiographic markers, you can take a wash and scan the intaglio of the denture in the same way that we described for a copy denture. Make sure that the impression material that you utilize is radio opaque. Then place the denture in the patient's mouth and take a CBCT scan with the denture in place. If your material is radio opaque, as you can see in the picture of the right, you should see a small layer showing us where the tissues are on the CBCT scan. If the patient does not have an existing denture, you can utilize the DENTCA trays, making sure that you use radio opaque light body material. And then once you're done taking the VD and the CR, take a CBCT scan of the patient with the DENTCA trays in place so we can see the intaglio surface in the CBCT scan. Once your implants are placed, it's time to deliver your DENTCA temp. Let's take a look at the first option, which is the DENTCA temp that will be seating over healing abutments. The second delivery option is what we call a DENTCA temp with temporary abutment cylinders. Let's take a look at the delivery process for this type of restoration. The second delivery option is what we call a DENTCA temp with temporary abutment cylinders. Let's take a look at the delivery process for this type of restoration. To order a DENTCA temp and surgical stent combination, click on Order, CAD/CAM denture, and find the DENTCA temp order. Once in, make sure that you specify the type of temporary that you would like us to make for you. If you do not like immediate loading solutions, you can always order an immediate denture from DENTCA and then deliver it that day. If you did a DENTCA temp and you're satisfied with the teeth design, you do not need to take another CVCT when you're ready to move on with DENTCA-4. Simply take a scan body or open tray impression record and order your DENTCA-4.